Hi, I'm Dr. Naz, and today I will be talking about controlled drugs in this clip. So, controlled drugs are drugs of potential abuse, which are divided into five categories. Schedule 1 includes drugs not used in medicinally, such as hallucinogenics, example LSD and cannabis. Schedule 2 includes dimorphine, morphine, pethidine, amphetamine, and cocaine. Schedule 3 includes barbiturates, buprenorphine, midazolam, temazepam, tramadol, carbapenem, and pregabalin. Schedule 4, Part 1 has benzodiazepines, except midazolam and temazepam, and zolpidem. Schedule 4, Part 2 has androgenics and anabolic steroids, HCG, and simatropin. Controlled drug prescription requirements do not apply, and Schedule 4 controlled drugs are not subject to safe study requirements. Schedule 5 includes preparations which, because of their strength, are exempt from vast majority of controlled drugs requirements other than retention of invoices. For example, oral morphine. So, the important points to remember here are that Schedule 2 and 3 are marked as CET in the BNF. A prescription of controlled drugs in Schedule 2, 3, and 4 is valid for 28 days. Prescribing controlled drugs. So, the prescription of controlled drugs that are subject to prescription requirements, that is, Schedule 2 and 3, must be indelible, must be signed by the prescriber, include the date on which they are signed, and specify the prescriber's address, must be within the UK. A computer generated prescription is acceptable, but the prescriber's signature must be handwritten. Advanced electronic signatures can be accepted for Schedule 2 and 3 controlled drugs where the EPS is used. All prescription for controlled drugs that are subject to the prescription requirement must always state the name and the address of the patient, the form and where appropriate, the strength of the preparation, either the total quantity in both words and figures of the preparation or the number in both words and figures of dosage units to be supplied. The dose cannot be written as directed, and it must be clearly defined. However, it is not necessary that the dose is stated in both words and figures. It is also compulsory to mention prescriber's name, signature, and current address. For example, morphine sulfate 10 milligram MR tablets, 10 milligram 12 hourly, supply 56, which and 56 should be in both numerical form and in words, tablets. For further reading, you can look up on controlled drugs page on BNF. I hope it was helpful. Please subscribe to my channel for more videos.